Let me tell you about my patient, Kenny. So, Kenny was a young man diagnosed with um, Hodgkin's lymphoma, which is a serious type of cancer. And he had tremendously bad nausea and vomiting, even though he was taking an anti nausea medication in conjunction with his chemotherapy. So he said to his doctor, I'm just having terrible problem with nausea and vomiting. And the doctor said, well, I can write you a prescription for Marinol. That's the drug made of THC. But many people find that smoking cannabis works a lot better and a lot quicker. So Kenny, who was a conservative person, found that while he was going through cancer therapy, nothing worked like cannabis for his nausea and vomiting. So today I'm going to be talking about the best herbs to stop nausea and vomiting. If you enjoyed this video, please be sure to like and subscribe to our channel for more videos like this, and be sure to hit the alert button to be notified of new videos each week. To me, treating nausea and vomiting is very similar. The same herbs work, and of course, in my early days up until my last days in the clinic, we had a lot of people with nausea. Most of them were dealing with radiation or chemotherapy or AIDS medications, but we had one gentleman who was diagnosed with cyclical vomiting syndrome. So, kind of once a week, he would have like 24-hour period where he would vomit, and we were able to help him, not totally, but to some extent, using many of these remedies and approaches that I'm going to be talking about. So the causes of vomiting are overeating, the early stages of pregnancy. It's how some people diagnose their pregnancy. Food poisoning, pain syndromes, emotional stress, stomach infection. Actually, nausea and vomiting can be a reaction to a foul smell or fragrance. Medication, and so that's the case of like Paxlovid mouth. Colonoscopy, so older people or people with colitis or Crohn's disease or a history of colon cancer get colonoscopy, which is makes you swallow this chalk-like mixture that's very, very bad, and it kind of lingers in your mouth, and you want to gag and vomit. So that's another example. Paxlovid is example. Preparation for colonoscopy. Those are just some of the many examples of medications that cause bad taste. Ulcers, gallbladder problems, ingestion of alcohol or toxins can cause vomiting. Brain injury. So that's really interesting. People I've seen with traumatic brain injury oftentimes have nausea and difficulty with their digestive system, which is all the more reason to see a natural practitioner to help restore the gut brain axis. And then cancer can also cause vomiting. And so let's look at some of the home remedies right now to stop vomiting. Okay, so the main one we know about, everybody probably knows about, is ginger. And what I want to talk about is one of the studies that I administered in Hawaii. Boy, life is hard for Andrew, huh? So I administered a study where we gave ginger capsules. We offered ginger capsules or a Dramamine-like anti-nausea drug over the counter to people going on a cruise ship. This is just a day cruise ship off the island of Maui, and where the currents are just very turbulent. And what was interesting is that 2 out of 3 people who chose something chose ginger rather than the anti-nausea drug. And well, they did that because ginger has no side effects, whereas a lot of these anti-nausea drugs do. Another time I was traveling in Vietnam with some women, and I'm going like, "What are you putting behind your ear?" And they go, "Oh, that's a scopolamine patch." So there's a drug created out of a toxin called scopolamine that people actually use as a topical patch for nausea. So that's an option if you have really bad nausea. So whether you use ginger capsules, whether you brew your own ginger tea with freshly grated ginger root, or you use a prepared ginger formula like ginger tea bags, These are all very effective. And last year, I had to take Flagyl for about a month, and I don't recommend that to anybody. And the only way I think I made it through is by sipping on ginger throughout the whole day. So mint is another herb which will help with vomiting and nausea. And in addition to the gums and the toothpaste that may help get the bad taste out of the mouth, actually by chewing on fresh mint leaves, if you can get them, can be a very, very effective way to stop vomiting and nausea. And what I would do is make peppermint tea, and then I brew it up, just tea bags is fine. Brew it up, and then I would basically swallow, or once it cools, of course, I would gargle or rinse my mouth and spit it out or swallow, either one, to help counter nausea and vomiting. Andrew would swallow actually his nausea and vomiting because the mint has very good natural chemicals that help with the digestion. One that you may not know of is cloves. And so, what you want to do is take about a teaspoonful of cloves, add it to about 8 ounces of water, boil it for 10 minutes, allow it to cool, and then drink it down. And cloves can be very powerful. Another gentleman I saw, he wasn't diagnosed with the condition, but he had vomiting every day. And cloves and a Chinese herbal formula are what it took for him to get back to a normal life. Okay, another thing that can help people, I don't use this, but other people do, so I thought I'd share it with you. And it's cider vinegar. The most common, of course, is apple cider vinegar. For reasons, complex reasons, I like balsamic vinegar, but you can use, most people know of apple cider vinegar. And people find that it works. Basically, a teaspoon of apple cider vinegar works either as something you rinse your mouth out and then spit it out, or you rinse your mouth and you swallow it. Now, as you probably know, vinegar can be a little bit kind of caustic to the mouth. And so, a good thing to do is mix 1 teaspoon of apple cider vinegar and 1 teaspoon of honey. And you put this in a glass of water and you drink it down, or you rinse with it. I would prefer to rinse and then drink it down also. But this can be very powerful. But don't forget to put it in about the teaspoon of vinegar, add the teaspoon of honey, and put it in a whole glass of water. Don't just take the vinegar directly. Another herb is fennel, and you can prepare that just in the same way as you prepare with cinnamon. Um, my mom and grandma liked crackers. Saltines were their favorite remedy for vomiting. And I want to talk a minute about odors. So again, people that have overcoming chronic diseases like long COVID, chronic fatigue syndrome, surgical recovery, their body is just very can be very um, get out of balance very easily. And so all of a sudden, a person's sensitive to odors, strange odors. And so, it's really good idea if you're subject to nausea and vomiting to get fresh air. And of course, breathing is very, very important. And for this case, we want to use kind of an even breathing, like 4 beats in, 4 beats out. So 1, 2, 3, 4 in, 1, 2, 3, 4 out. It's really, really good, especially if you can do that with fresh air. Okay, cinnamon is probably one of the last remedies that I'm going to be talking about, and that can be prepared much in the same way as you prepare fennel. You boil a cup of water, add teaspoon powder, and allow it to steep for about 5 minutes, and then strain it. That'll be very good. Um, and then, of course, you could use cinnamon candies or gums if you're so inclined for bad taste, and they will help a little bit also for nausea and vomiting. Okay, so now I want to talk about one of the most interesting remedies for nausea and vomiting, and that's cannabis. And my colleague in San Francisco, Dr. Donald Abrams, did a study in the 1990s, and they basically offered cancer and AIDS patients the choice, or some of them were enrolled in the drug called Marinol, which is synthetic THC, which is a licensed drug, whereas the other group was assigned to smoking cannabis. And guess what worked better? Yes, the people that smoked cannabis found that it worked much more quickly to relieve nausea and vomiting than people that took the drug in a pill form. They also liked the fact, in general, people who are researchers or people who use cannabis feel that the actual natural cannabis leaf has many cofactors. In addition to THC, you have CBD, which is a cofactor. You have other natural chemicals in the cannabis plant. Whereas if you just use THC by itself, you may have more side effects. And many people find that it just doesn't last as well, doesn't work as well for nausea and vomiting. So you do want to consider for nausea and vomiting cannabis. Now, I would say that to update that conversation, you want to consider vaping. So vaping has only been around for 5 or 10 years. And so vaping would be the way to use cannabis for nausea and vomiting. Probably the second way, if you can't vape, would be to smoke because it gets into the body much quicker. And then finally, you could try gummies that have sublingual um, absorption, and that might also help with bad taste as well. So that concludes today's podcast. Be sure to subscribe, that really helps us, and let us know what you think. For more information, visit our website, getwellfoundation.org.